Dr. Choll Kim here from sunny San Diego, California. We are getting started. We have star power here. Look at this crew. They're ready to kick some butt because we have to do a very good job today on this facet cyst. Check this out. Look at that monster right there. It's completely occluding the left lateral recess, and of course, she has severe left leg pain. I did a previous MIST lift at 4-5, which had a spondy. So this is essentially a form of adjacent level degeneration. Even though we don't hardly ever get that after MIS surgery, there's no such thing as always. So I'm gonna make a little poke hole, sneak in there with an endoscope, and excise this and free up all the nerves, followed by a little Band-Aid. So wish me luck. We are getting started. That's the navigation tracking pin. That would be the antenna on your car. That's the road down there, your spine. And look at that. That's exactly where the facet cyst is. That's exactly where I'm going to go in. If you look at the navigation monitor, that's how I know exactly where to put everything. That's where your facet cyst is from here to there. So I'm going to take this as the superior lateral corner. I've got the most awesome window and approach trajectory. And I have the regular 2 Terry next. Just making my way down to the promised land, as they say. So there's 2 components. There's a hard component. That means it's been around for a while. And a new component right there. It gets bigger and smaller. That's probably what popped up when you went to the ER, you poor thing. But this thing looks gnarly. But it's soon going to be history. I am all over this thing. If you examine this, it's called myxoid tissue. Myxoid. Proteoglycans, collagen, and gel-like material. That's the drill tube on the other side. Look at that thing pulsate. If she was awake, she would have gone like this. Oh, I feel so much better. What'd you do, Dr. Kim? There it is, totally stuck to the dural tube. That's the other side, I bet. Going all the way to the other side of the canal. But you don't have problems on the right side. But I'm still gonna look over there because, yeah, I check my car alarm 3 times before I come in. Regular 2 Terry. Don't get mad at me, but this is such a cool surgery. This is the gnarliest facet cyst that I've seen in a very long time. It's going to be so gratifying to get rid of this thing. It's going to be like, I don't know, popping a juicy pimple. Here's the navigation probe. It's skirting down that edge. If you look over there, left lower hand corner, that's exactly where the cyst was. It's actually all in here. Oh, I'm feeling good. I see the drill tube pulsating. Just need to go way deep and make sure everything's loose and free and mobile. There's the disc right there. Sneaky, I know. There's the disc. Everything is stuck to it. The cyst. Oh, ho, 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 not no more. I think this is the inside wall of the cyst, by the way. Okay, I think I'm done. Look at that. It's pulsating like crazy. That's where the facet cyst is. Not no more. Surgery all done. Look how cute that little poke hole is. Followed by the world's most expensive Band-Aid. That was for the computer navigation tracking pin, but oh my God, the surgery went so well. I can't wait for you to see the video because there was so much junk coming out. It felt so gratifying, like popping a huge, juicy pimple. It hits the wind, like the mirror in your bathroom. You're like, oh, gross, but so awesome. That's what your facet cyst was like. So I'm expecting you to get a great result, and we're all praying for a speedy recovery, so best wishes.